I was seeing a surgical consultation yesterday, and one of the questions that I want to know about during our consultation is what you do for a living. The patient wanted to know why that mattered and how that sort of gets roped into this whole surgery consultation. And so I figured it would be a good thing to make a video about it. For those of you guys who don't know me, my name is Dr. Megan Drevskra. I'm a board certified plastic surgeon in Seattle, Washington, and I specialize in aesthetic procedures of the breast and body. So yes, when you come in to see me for a surgical consultation, we are going to talk about all the things having to do with surgery. We are going to talk about your anatomy. We're going to talk about your surgical goals. We are going to talk about the surgical plan that I think is best for you. But one thing we can't ignore is recovery. And one thing that is integral to recovery is, when are you going to get back to work? What is the nature of your work? Is it going to compromise our surgical results? And then timing for surgery. So let's start with when you can get back to work. Obviously, that is going to be very different if you, for example, have a work from home job that has a lot of flexibility and you can pop back on your laptop, for a couple hours here, a couple hours there, versus somebody who maybe works in like an Amazon warehouse, right? Where they're doing a lot of heavy lifting and you have to be in the office. Another thing to consider is if going back to work is going to compromise your surgical results. These are elective procedures, and oftentimes, these are procedures that patients bank up PTO days for, or they couple them in terms of their recovery with like a holiday or already kind of planned time off work because they really want to maximize their recovery days. What we're trying to avoid is a patient going back to work too early and potentially compromising their surgical results. So, causing a wound dehiscence or getting an infection or something like that. You're investing a lot of time and money into these procedures and also the recovery, so it's important to get the best recovery possible. The last thing has to do with timing, right? These are elective procedures. So thinking about all of these things, what you do for work, what is the nature of your work, what is kind of the ebbs and flows or like the seasons to your work. It's also really common for me to inquire about the ages of your kids. Are you primary caretaker? All of these things, because it's really about planning. I want you to plan your surgery when you have the most help at home and the least on your to-do list. So yes, we're going to talk about a lot of different things during your surgical consultation. Part of it is getting to know you. Obviously, a large part of that has to do with surgery, but it's really, really important to not dismiss all of the post-op recovery, okay? Because surgery really is everything that happens leading up to surgery, what happens during surgery, and then everything after. As always, if you guys have any questions on this, leave them in the comments below. Give me a follow if you like my content, and I'll keep making more.